Hello everybody. So this video is on the IHC p40 and p63. As we all know, both these markers are used to identify squamous differentiation. This is a nuclear transcription factor. p40 is a non-transactivating isoform of p63 and hence it is more specific for squamous differentiation. It helps to identify squamous cell carcinoma, basal cell carcinoma and the myoepithelial cells also. It's widely used in lung, head and neck, breast and salivary gland tumors. Usually these markers are expressed in the basal cells of the stratified squamous epithelium, also seen in myoepithelial cells of breast, salivary gland and sweat gland, and hence you will see them common in these type of tumors. P63 is very sensitive for basal or squamous differentiation. The difference is P40 is more specific than P63 when it comes to staining squamous differentiation. Tumors which are positive for these markers, squamous cell carcinoma is positive for both p63 and p40. Spindle cell or sarcoidoid carcinoma also is positive, and here it can be used to identify the epithelial origin in these tumors. Salivary gland tumors arising from myoepithelial cells are positive. In breast also, here it is used to detect the myoepithelial cells in DCIS versus your invasive tumors where there is no myoepithelial cells. P63 is more sensitive, but P40 is very specific when it comes to squamous differentiation. When you look at the differences, as we already highlighted, both are sensitive, but when it comes to specificity, P40 is very specific. There are less false positives in P40 IHC, as P63 can even stain sometimes non-squamous origin tissues. Currently, P40 is the preferred marker for lung squamous cell carcinomas, whereas in breast and salivary gland where myoepithelial cells are needed to be highlighted, we use p63. Like all IHC markers, at times these markers also have few limitations such as p63 staining adenocarcinomas or benign reactive tissues, and hence we should always use IHC with clinical correlation, imaging correlation and with morphology and other IHC markers to support your diagnosis. Example CK5 bar 6, 7 bar 20, CDX2, TTF1, GATA3 and PAX8 for the respective origin. Finally, when do we use it? Both P63 and P40 are usually used to confirm your squamous lineage or myoepithelial lineage when it comes to P63. P40 is more specific, but P63 is more sensitive. We report it as nuclear positivity. We have to always interpret this along with morphology to get your accurate diagnosis. Thank you.